Morning, everyone, and welcome to the Frontenac County's council meeting for March the 19th. We begin this with this gathering by acknowledging and celebrating these traditional lands as a gathering place of the First Peoples and their ancestors who were entrusted to care for Mother Earth since time immemorial. We do so respecting both the land and the Indigenous people who continue to walk with us through this world. Today, the county is committed to working with Indigenous peoples and all residents to pursue a united path of reconciliation. We have no closed session. There are no addendums. Does anyone wish to declare a pecuniary interest or general nature thereof? Seeing none. Adoption of the minutes.
Moved by Councillor Fowler, seconded by Councillor Leonard. Resolved that the minutes of the regular council meeting held February 19th, 2025 be adopted.
Are there any comments? In favor? Carried. We have no delegations or presentations. We have no proclamations. Move into the committee of the whole.
Moved by Deputy Warden Saunders, seconded by Councillor Smith, that council adjourn and meet as committee of the whole council with the Deputy Warden in the chair.
Any comments? In favor? Carried. Deputy Warden.
So be careful what I say. Thank you, Warden. Good morning, everyone. With council's permission, what we would like to do is adjust the order of the agenda to respect Mr. Woods' time and have the present the findings of the operational review healthcare in our community. We are going to consider the first two items from the recommended reports from the Chief Administrative Officer. That's Clause A, which is a briefing by Mr. Rob Wood, and Clause B, which is consideration of the report 2025-034, Operational Review, Healthcare in the Community. So with Council's approval, is everyone okay if we do that? Thank you very much. That being the case, what we will do is turn to page 3 and deal with recommendation reports from the Chief Administrative Officer, consultant briefing. And I'd ask Ms. Debbie Miller to come to the podium.
Thank you. Healthcare in Frontenac County is at a pivotal moment and requires support on numerous levels to be sustained as a critical part of Frontenac communities. Beginning in August 2024, the county hired consultant Rob Wood, president and CEO of 80/20 Incorporated, Info Incorporated, to lead the healthcare in our community operational review of the 4 Frontenac County clinics. The administrative burden considered within the scope of the operational review included, but was not limited to, recruiting staff, job postings, payroll, vacation approvals, and day-to-day coverage, training, IT support, policies and procedures, and oversight for cleaning, property maintenance, including snow removal and lawn care. By alleviating or reducing the administrative burden, it would allow primary care providers at the clinics to focus on healthcare rather than the day-to-day requirements of operating a business. Throughout the review, it became evident that no single approach could unify and improve all 4 clinics, as each operates under a different model with distinct priorities, issues, and impacts. Local solutions were discussed, exploring clinic models and broader issues related to the recruitment, retention, and sustainability, which are ongoing in support of the clinics to ease the administrative burden and ultimately support the retention and recruitment. Throughout the operational review process, I have met with and learned from a variety of connected healthcare professionals, including primary care providers, clinic staff, and volunteers from the Frontenac County clinics. Thank you, Dr. Dietrich, Sheila McDonald, Elizabeth Bigelow, and Kathy Glantz for joining in person and virtually today. The passion they all hold for the Frontenac community is evident, and they need support. Dr. Kim Morrison has been invited to present at a future County Council meeting with an update from the Frontenac, Lennox, and Addington Ontario Health Team, the FLA OHT, and Dr. Jane Philpott's Primary Care Action Plan, the $1.8 billion funding. So just FYI on that piece. I would now like to introduce Rob Wood, who will walk through the findings and recommendations from the operational review. Rob is deeply immersed in the healthcare sector, bringing a wealth of knowledge and experience to the project, and has been working with the Ontario Health Team, the FLA OHT, for the past 4 years in the consulting role of collaboration coach. I'm going to turn it over to Rob now.
Thank you, Debbie, and council. Really a pleasure to be here today to have a chance to talk about one of the most important issues that affect the individuals in our communities. And I know you're well aware of that, whether some of you have deep background in healthcare and others have had experience as a patient in healthcare. And there are so many issues, whether it's chronic care, whether you've had a sports injury, whether undiagnosed cancer, whether it's diabetes, any number of things. Primary care clinics are really the gateway to the entire healthcare system that we have, the whole continuum of care, including community services and tying in with those, the paramedic program and other aspects that you operate. Long-term care, it's really the centerpiece. And appreciate that you give us 10 minutes. I hope I can keep my remarks to the point and that you have lots of chance to ask questions, to clarify, or to probe the aspects, because your leadership as community leaders and you're close to the pressure points will really help us on the next step of the journey. When we started this assignment, and maybe I was a bit naive, but Debbie and I quickly realized that I think we went looking for a kind of a couple of silver bullets, a couple of things that would be the same all across the county that we could come back and say, here are 2 things you could do, and it will really improve the situation. But we found every area, every township, every clinic had their own kind of sets of supports, issues, and so forth. So there was no one size fits all. We're also kind of a rising sense of concern, both for the short term and the longer term, short term being a couple of years. But as we range across the county, if I start in the north and you look at the physician side of things, we have one great physician who's worked on an 80-hour-a-week model, and but he's at least a decade beyond normal retirement age. He's supervising a new international medical graduate who's another person there who practices under his license still. We have locums, temporary physicians that are helping out in places. If we come further south, we have a doctor who's carrying the load of 2 physicians, actually a little more than that. Come a little further south, and we've got a doc who's going to be retiring in a little over 2 years, 2.5 years. We have another one who will probably go in 3.5 to 4. And then we have another one who's saying, I'm not taking 5,000 patients on from there. And then when we go further south, when we come to the islands, we have no physicians on the islands. We have a very vigorous volunteer group who have been involved in this process. It's been terrific. But we don't have a resident doctor. We don't have a resident MP. We have transportation issues. We have a system that doesn't really see the rurality and the remoteness that's involved when it's not just where the crow flies across. So a lot of different kinds of issues and thinness of where we may be in 2 or 3 years. So as we went into probed into it, as Debbie has mentioned in her report, we met first with all of the clinics, then we met individually to probe individual issues. We came together and brought the whole group with what we thought our initial findings are, and we've included them in your report today. I think in addition that the areas are different and the needs are different, the models as a business are different as an administrative group. So one is very volunteer supported. Some have a family health team, like Northbrook also has a family health team. Then we have others who are on closer to a fee-for-service kind of a model under great pressure, as it is in all areas as we look at that. And we also looked at some of the other municipal supports and community supports, efforts that are going on with different partners for recruitment of physicians and other staff. It's not only physicians, it includes nurse practitioners, it includes frontline staff. You know, docs talk to us and say, I had to pay $2 more an hour for my frontline receptionist to keep the person and so forth. So we heard all of these stories and we tried to outline those here. But the retirements, the challenges of retention, we're short 3,500 physicians in the province. The successes that we've seen have been really around creating opportunities in communities where physicians and other staff want to practice primary care. And that's what we hear repeatedly. And the successes that we've heard, we've had cases where, you know, children of doctors who became doctors went someplace else because they had a better kind of a situation. Young doctors today coming into practice don't want to take on a 10-year lease. They don't want to carry 1,800 patients. They don't want to do many of these other things. They'd like to be able to leave without losing money because you have to pay a locum more than they earn themselves, or they don't want to end up having to work as a hospitalist or in other roles in order to supplement income. They want to be able to take a vacation without worrying. They sometimes have children and they don't want to work the extended hours that many of our docs here in the county have so compassionately given. So as we looked at that, we started to focus in on the issues of sustainability of the practice and where is that going. And the other part was about making sure that it's attractive for renewal and new staff over time. And so that leads us to the issues of finding a more sustainable model. And on that point, maybe I can move to, I think it's page 66 in your package. But if I skip directly to the recommendations, our findings that we think there may be some opportunities together. And I kind of say that county and townships, because there's a lot of alignment with the townships as well of what we might do to sustain our groups. So the first recommendation was about helping primary care clinics, and I'd say this particularly for South Frontenac, transition to a more sustainable and attractive business model for now and for renewal and attracting new physicians over time. We've seen that areas that have the supports of family health team and strong municipal shared facilities and so forth do better than those without. So I've mentioned here an increasing interest in an employment-based model where physicians have an employer still bill for a blended fee model, and but they are relieved of some of the burdens of back office services, of HR hiring, of finance, of tech, maybe groundskeeping, all the kinds of things. Family health teams themselves do have a mandate around community development and public health, but physicians benefit greatly from that association, which we see in, say, with Upper Canada, supporting Gananoque and Lansdowne, places like that. We see it in Napanee, which has established a new Greater Napanee Health Home, where the town of Napanee invested substantially in collaboration with the LNA Hospital to create spaces and so forth for the Mighty Docs group to pull in. And so they're being integrated. The employer there has become the Kingston Community Health Centers. They've taken that on. The same group that also took on the Midtown health team, which is on Princess Street, Midtown, but it's a model that the province and Jane Philpott in particular has been a champion of team-based care with allied services, one place to go, easy access to OT, PT, nurses, nursing practitioners, allied health, and all its forms, dietary, pharmacy, all these other elements, and special programs and clinics and so forth that go with it. We see the province moving that way. We see young doctors wanting to practice in that kind of team-based, employer-based kind of setting. The trick may be, how do we explore moving to there from here? We're closer in some areas. In Sharper Lake, we're much closer in that kind of an area. So this is the one of the major elements, and if we do want to pursue it, I think the docs are open to this, is we need to negotiate some building blocks. So how might we find an employer who wants to take that on? And it's premature to ask a municipality to contribute on some of these benefits programs or whatever if they might end up with a different employer. But we flagged that, and we've got some examples. And just last week in Toronto at the Primary Care Summit lunch, the examples in our area were held out as an example for the province of where we're going. So we have a pretty good feeling that this is the direction. The province has also announced $1.8 billion to improve access in primary care. And so we're saying, is that presenting a kind of a once in a decade opportunity for us to tap into that? Those regulations haven't come down. We thought we might have them by now. Kim Morrison says, no, nothing at least until the end of the month. So we'll see. So there were other things that we included as examples in there. We've talked as a group about sharing resources, skills, knowledge. It could be a job description. It could be a template. It could be an example of how to prompt AI to produce better chart notes, any number of things that we could look to share together and work together. One observation was that in some ways Sharp Lake's experience and Wolf Island's experience are actually more similar than some of the other pieces. So how can we work together? There's also the part about developing a business plan if we can pursue an employment-based model. And the last part was connecting with clinics and LNA. So that's a practical consideration. In our county, we have physicians in the north, which are allied out of Sharp Lake, allied with Tay River in Perth. Perth has 28 physicians, just for information. And then with the rural Kingston group, we have physicians who are in my hometown of Newburgh and Tamworth. And there are alliances also with the LNA Hospital and the primary care group there. So we have this kind of an element. Are there opportunities that we share together? There are a lot of lessons learned and partnerships, I think, with Northbrook compared to Sharp Lake as an example. How can we work together on that? So that was the first one. As leaders of our community, you may say that's worth pursuing. You may have a different angle, and some of you have experience in running these kinds of healthcare models. So I look forward to that. The others I'll run through more quickly. Supporting initiatives to bring healthcare services to Frontenac Islands. I think that bears highlighting as a unique situation, not only here, but through much of the province. One of the examples that came forward from Sheila and Nancy and Kathy and others that were involved from the island was what are the opportunities around a mobile clinic? We have one in town, but it may not really quite be the way that we would need it for the island. We've talked other things that aren't in here. Is there a way to reach out to regional medical education or the Queen's Department of Family Medicine and find grads there or medical students and residents who could perhaps under their supervision reach out? We can reach out to Elaine Ma and the Frontenac doctors who already, I understand, have about 700 patients on the island. Is there something we can do there? Can we chip away the transportation issue? But one of the big things was the rural index, which Sharp Lake has. Sydenham seems to be the same level as Kingston for some reason. I don't quite get that. But there may be some things we can probe on the way they calculate that. One is, are there mixed data of across the pond and the island? Are those numbers mixed together? Things like, have they measured the transportation element of the index, that they didn't realize there's a body of water and a ferry in between going a few miles across. So those are things that we can look at, and then connecting with those providers to see, advocating on behalf of the island with the great volunteer group that is there to see what we can do to bring healthcare services, whether it's clinics, whether it's having regular presence of nurse practitioners and others working on that. And there are changes in what's happening on the horizon with nurse practitioners, so there may be opportunities to explore there. The last 3 or 4, one was about a collaborative recruitment retention program. So one observation, 2 observations. One is that physicians there is regular turnover and they spend a lot of time on the HR file, whether it's getting a job description together, posting it, screening, interviewing, hiring, onboarding, all those kinds of factors. But many of them do need to be done by a clinic to have the right fit. But there's a lot of piecemeal efforts out there, whether it's through a website here, an OHT posting here. So we've talked both to OHT and among the groups with the CAOs, can we kind of coordinate how we communicate that, how we advertise that, how we work on that? And then you have your own initiative with the Eastern Ontario Physician Recruitment Alliance, which is taking our message further across. The other part that ties in, and it's kind of in the next one, but it's about the role of community in trying to attract a physician. And so we've seen that some of the best successes have been where it's not only a physician or healthcare professional coming for a job, but but they're also coming for a lifestyle. They're bringing their family. They want to practice the way they do. And some of the recent successes we've seen where the whole community has rallied around. It reminds me of a movie, maybe you saw it, of a small village in Newfoundland where the whole community kind of connived to be able to attract, including finding a date for the prospective doctor they were trying to bring in. So in a way, we kind of see ourselves headed that way. And then harmonizing recruitment efforts kind of across the area. So I talked last week with Kim Morrison from the OHT about this and said, you know, many of the tasks we have in HR, which are owners for the physicians, are the same, whether it's in other parts of KFL&A. And so there may be ways that we can harmonize those efforts, not to do the last stage hiring, but to simplify and streamline and have one point to apply and instead of having 8 different places to look. So there was that to support the health HR. Then we had engaging the community members, which I just mentioned. There seemed to be general interest in the idea of an advisory group. Probably some of the most exuberant and greatest examples are around Wolf Island right now, but we have advocates in North and Central and in South as well of the Frontenacs. We imagined in our discussions that there might be a way that these community citizens who are health interested could both be a liaison for the clinics with the community, that they could also be a source of advice and input for you, and they could also be partners in the recruitment effort. So that when a doc is walking around, maybe there's a need for spousal employment sometimes come up. That would be an example. Is there someone in the community that could help? At the Primary Care Network Summit a couple of weeks ago, we heard about a model, and this is in Toronto, but they have community people that live in the big buildings there. So when people don't show up for appointments and so forth, they are called ambassadors in that particular district. But they are kind of reaching out and helping people in the community, especially those. You know, we heard stories of people going 10, 15 years and then finding they have an undiagnosed cancer. So if they aren't connecting with primary care, it's time that we did some help for them. So we saw a community role there. Then we had practical steps to reduce the admin burden. I think those are bit by bit, seeing what makes sense to do. We thought coming in, maybe benefits would be an area because that's what's happening in some other communities where they've taken clinic staff on payroll and or brought them on for benefits. In this case, we have some physicians who have partners who work for the Ontario government or other places, as I do. My wife was a long time with Victim Witness program, so my benefits were covered that way. But a new physician coming to the practice may not have that. And so we may have an opportunity there or not. We think we should take a practical approach was our finding on that one. And the last two, I wanted to mention technology. I know this has been discussed also with the Eastern Ontario Wardens Caucus. It's certainly discussed a lot at the OHT. Our own experience in Frontenac County, the physicians have found that Scribe AI and using AI for dictating chart notes and so forth has had kind of a mixed result. And so we've connected our physicians with, or they've connected themselves with some digital experts and coaches to help with implementation of technology. We're trying to connect them with groups like Maple Family Health Team that have done some pioneering work on how to dictate prompts to make the outcome come better. It's a changing field. Some we're talking about, should municipalities support technology? The advice we got back was there's changing technology, AI Scribe being one, but some are embedding them now in the EMR, in the electronic medical records that they have. So the advice we got was, in fact, what's happening in Frontenac County, there's 130, or KFL&A, there's 130 docs. Some have turned in their licenses because the technology is now in their EMR. There are others who are picking them up, and there are others who are taking training, online booking and that type of thing, all to be explored. One of the big problems, though, admin burden, has been keeping up. Any small organizations go, oh, so when do I do my Windows 11 update? And oh my God, all the prompts are in a different place. And something new on cybersecurity, do I have to read everything to keep up? That's taking people away from practicing medicine. So the last one was about connections, communications, and partnerships. I think we have a good spirit of communication and connection. There was an interest in sharing information, sharing expertise. Tech was one area. But we don't have a sustainable tech thing. It's good that we have an OHT, or not an OHT, a family health team manager who's become quite good at tech. It's good that we have a nurse practitioner in Northbrook on the LNA side who's quite good in tech. But what about if they change, they move? And what about those who don't have tech support? Some have limited support because they hire it from the community. These are all areas of expertise and support that we could look at. I'm sorry I went longer than I intended, Deputy Warden, but I certainly would be glad to answer any questions the councillors may have. So.
Well, thank you, Mr. Wood, for a very thorough report. And I'm sure council will be more than willing to waive our procedural bylaw and allow you any additional time that you require.
Okay, thank you.
Before I turn it over to the rest of council for questions and comments, I do want to thank you for noticing or highlighting the unique challenges we have on the islands. There's an active group trying to find solutions, but we tend to run into more barriers than solutions. So I do appreciate you highlighting that. And on a positive note, tomorrow I have my first intake interview with a family doctor
Excellent.
after 5 years without a doctor.
Yeah,
Now, unfortunately, they're associated with Kingston, but anyway, a doctor's a doctor.
yeah,
So thank you again for your report.
okay.
So can I ask council, we'll go around the table for comments, questions?
I'll start. Thank you so much. This is something that we really, really have to put a lot of work into because people come to our communities because we have doctors and we have those services. You talk about an advisory group, and certainly I would believe that this council would be interested in putting someone on that group. I would volunteer since I am the chair of the Sharpet Lake Family Health Team and have been involved with the health team since 2005, since it started. So I would certainly be willing to work on that. And our doc is retiring, just a matter of the day. And we all are going to be in trouble if we cannot keep our doctors. So thank you for the work, and thank you for the work that's yet to come.
Okay, thank you.
I'll go around the table. Councillor Fowler?
Yes, thank you very much. A good presentation, Rob. Yesterday, I was at a presentation run by seniors and law enforcement together, and the presentation was from our paramedics, the community paramedic program, which has relieved a lot of the work that doctors and other people have. I was really amazed at it, at how much they do in the community. And what they do is they go into people's homes, and if they need a shot or IV or something like that, or some kind of task, they're there to do that. And I don't know if I expect you would know about that. But yeah.
In fact, we talked with Mark Gowdy about that in this project as well. So it certainly is valuable. And yesterday in LNA, they mentioned that as well as a program that's so essential, both to prevent, it's where do people land in the system? We want them to be in the best place. Now we've got the deputy warden connected, but community paramedicine is really important there. Yeah. Did you see an area where that might connect with our findings here, or something we might do further?
Well, I was listening to your presentation, and you didn't really mention it, so that's why I brought it up, because it's what they do is really helpful in the community.
But I would just say we didn't mention it particularly here because we were focused more on the admin side, and there were the discussions, the clinics connect with them and are aware of them. And Mark has extended a hand to try and integrate better, but we didn't see it as an admin burden type of issue. So we kind of left that to the side. You have 135 pages, so we tried to keep it down. Yeah.
Councillor Leonard, do you have any comments or questions?
Well, thank you very much for your information that you provided. And I do realize that we do have to come together and we have to work harder. Because lucky enough, I've had a family physician for over 70 years.
And look at the good result.
Yeah, that's a good result. And I think lots of times the people that has a long-term physician don't really look at the ones that need it.
Yeah.
Glad to see that our deputy warden has finally got one. But I think there's a lot of work we have to do yet, whether it's north, south, wherever. We have to continue doing. Thanks for your.
I appreciate your point about the anxiety that comes for people who aren't attached to a family physician. We saw that in another community, our size, rural, where 3 doctors retired and 5,000 people were without a doctor, including one was my brother. And I know that he went for 2 years, he searched everywhere. And every time, if you have something going wrong, as we get older, then it's a concern that you have no point of entry other than going to Emerge, which is not the right solution for this as well. So appreciate that advice.
Well, the one thing, I have been in Emerge a few times. And everybody likes to say, oh, this, that, and everything else. I have nothing but good results when I went to Emerge. And even the food was good the last time I was in there.
Oh, my
So
God.
there you go.
Yeah.
Things are looking up.
That is
Thank
great.
you.
We know the care is good. It's whenever there's too many at the door that make it in trouble. They didn't serve refreshments with that food, did they? There you go. Thank you.
Counselor Gowdy?
Thank you, Deputy Warden. And then again, thank you for the presentation. It was very enlightening. And I loved all the comments about community connections
Mhm.
and that, and getting, it's the connections, it's people on the ground that are going to help build our healthcare up even further. If it's a home help or a PSW that sees a client on a regular basis, that notices a decline in that client, and maybe they don't have a family doctor, they don't have any connection, but they need help. And they don't, some people in rural areas don't like to reach out and ask for that help.
Right. And some are very subtle, whether it's a mental health issue, and sometimes issues are not every day, it's just a couple of days and go on. I don't know whether Dr. Dietrich remembers this, but the first time I met her some years ago, we talked about what it was like to have a kid in a basement having suicidal thoughts and how important the personal connections were to connect that person, that family, with someone that you knew or could refer to on. That's the kind of fundamental role that primary care docs and clinics are doing. So, but the PSW side, all of those elements are all part of it, and changing as well. But if you want to get off Pigeon Island on Eagle Lake and kind of get there, we need to hear those voices too, right? So,
Correct.
yeah.
Thank you.
Counselor Greenwood Spears?
Thank you very much for the presentation. That on the rural index and that for Frontenac Islands and that it ties in with a meeting that I actually have had with Stats Canada and that, and it clearly is a misuse of their stats to lump Wolf in particular into the urban area of Kingston. Howe Island, not as much of a reach in that because they have 2 ferries that run, one of them 24 hours a day, and that
Right.
the isolation factor, especially of Wolf, and that right from Stats Canada, they would be very supportive for us to get that changed, and they were quite clear that it is a true misuse of it. So it doesn't make it easier, but I have broached that topic with our CAO and that, and I will probably continue on that to get it fixed because it affects us on a lot of different levels. I wonder about the Starlink that the province has canceled and that was in support of the cellular service in the rural community. I don't know whether we've had any update on that as to who's picking up the providing, because when you're talking about technology and having the ability for telehealth and everything else and that, it's going to be important, and it's something that we need to look at. When you talked about the spousal employment and that, one of the other things that I've come across in my years is that identifying school for the kids, and
Yes.
that frequently they might not think that the smaller rural schools are quite up to the standards of getting their kids into the better academic. And so that's one of the considerations that has been made, as well as trails and that. And I've seen a neurologist lost because of lack of bike trails and that. Well, the good news is we could actually highlight our KNP trail and that as a attractive feature, because lifestyle is really important to these people.
Yeah.
And the final piece, when I look at trying to recruit physicians and knowing that there's fewer barriers when we actually bring them from the States at some point, and that doing some limited advertising in the red states, because there's a whole lot of physicians that are very, very dissatisfied in that because of the abortion access and things of that nature that are looking. And I know that there's in BC, I think they have got it down to 6 weeks to streamline the physicians coming in and getting
Mhm.
into practice.
Yeah.
So that's the sort of thing that, you know, they're lost. I won't cry about it. And if the physicians want to come north, that would be wonderful. The final piece, the family health teams and community CHCs. And I just wondered about whether anybody's reached out to Country Roads at Portland
Mhm.
and that, because I know when I was Director of Operations and Information Management, and that we actually had a satellite set up in another area and that already has all the infrastructure related to the physicians and hiring practices and
Right.
finance, et cetera, and that. And I know that they reached out to Westport and helped them. So the CHC, and I've worked in a lot of areas of healthcare, the CHCs are the most cost-effective model of healthcare I've ever come across.
Yeah. And
Okay.
CHCs are kind of very directly aligned with the health home concept that people are using now too. So we didn't talk to Country Roads, but I see your point for sure. It makes a lot of sense.
Warren Licky.
Thank you. First of all, thank you to the Frontenac staff, Debbie, and thank you for this information. I was going to say great, but to me, there's a lot of challenges here. And it's something to really look forward to. I was involved with the Lakelands Family Health Team trying to recruit a doctor, and we ended up bringing one from Wales. And it's financially not prohibitive, but it borders on it. The rurality index, ours is $92,000, where Charlotte Lakes is about 87 or 88 or something, and it's not enough. Because somebody like Napanee or Belleville or Kingston will put $50,000 or $60,000 on the table for a nurse practitioner. So all these good things we're saying is all true, but we as a council are going to have to come to grips with this come this fall when we actually do the budget, because what we're putting away really is most likely not enough. That's just my opinion. Community involvement, really, really important. Make them feel welcome. Bring them into the community. Where does the spouse work if he or she wants to? Where do the kids go to school? Where is the recreation?
Where do you
all
find
that?
a house? Yeah.
And then you have the retention issue,
Mhm.
especially if you bring someone from overseas or from another country. And they have all the skills and so on. They go through those few hoops and loops they have to go through. They're in business, and 2 years later, they go to Toronto, exactly. And you're sitting, you're out $100,000, $200,000 for a small municipality, and that doesn't happen. And you start the process all over again. So in Northbrook's case, their doctor that was there, or one of them, had retired. And the new one came in and took 1,500 patients. The community is absolutely beyond belief. They're so happy. We get people saying, I finally have a doctor, just like you did. It's such a relief. And this guy really works hard, and he likes the North. So you have to sort of bring all the stars in alignment, and it's really difficult to do. So thank you for highlighting all this. And I'm really looking forward to the next set of, the challenges that come out of this, because I think we can actually do this. So thank you.
Thank you for that.
Thank you, Warden. Mr. Wood, if you wouldn't mind, you have some guests behind you or some support? I don't think I know those folks. I don't know if you want to introduce them or not.
I think Debbie could probably do the best job on that, but they have certainly been deeply involved in this process for sure.
Thank you, and thank you for the comments as well. So I'd like to introduce behind me here, Dr. Jeanette Dietrich, who's with the Sydenham Clinic, and Sheila McDonald, who's a volunteer with the Wolf Island Community Medical Clinic. And then also on the line, Elizabeth Bigelow is online from the Charlotte Lake Clinic, and also online is Kathy Gantz with the Wolf Island Medical Clinic as well. So thank you.
Well, on behalf of council, I want to thank the whole team for the excellent work you've done. So much appreciated. Thank you. So that item being completed, we'll now move to the next item, which is 2025-034, Planning and Economic Development Operational Review, Healthcare in Our Community Recommendation.
Moved by Councillor Greenwood Spears, seconded by Councillor Gowdy. Be it resolved that County Council receives the health care in our community report and presentation provided by 8020 Info Inc., and that Council of the Corporation of the County of Frontenac approve the proposed recommendations outlined in the health care in our community report and presentation attached to this report as Appendix A, and that staff develop an implementation plan outlining actions, schedule, and costs associated with the recommendations outlined in the report, and further that the implementation plan be presented to County Council prior to the 2026 budget deliberations.
May I have a mover for that recommendation? Councillor Smith and, oh, thank you. As always, one step ahead. Comments, questions? Seeing none? All in favor? Approved. Thank you. We'll now return to, thank you all, by the way. Thank you so much. We'll now return to the regular portion of our agenda with briefings from Mr. Kevin Farrell, our Chief Administrative Officer.
Perfect. So good morning, Warden, Deputy Warden, and Council. I'll take you through the CAO update for March 2025. As always, I will touch on the main points and happy to answer any questions. So first off, just to highlight a few items from my March schedule. On March 4th, the Governance Review Committee met to continue their discussion on land use and delegated authority policies. Council will see these later on today's agenda. The committee also began initial discussions on public notice and procurement policies. On March 6th, I was joined by Fairmount Administrator Susan Brandt and Director of Care Emily Schonecker on a tour of Northumberland County's new long-term care home, the Golden Plough Lodge. We were able to see and discuss some of the design elements and hear some of the challenges and successes associated with this project. This Friday, March 21st, our Frontenac senior leadership team will be meeting with our counterparts from the City of Kingston at City Hall to focus on information sharing and relationship building, and Frontenac will host a subsequent meeting later in the year. I'm planning to attend the Central Frontenac Council meeting on March 25th, along with Tyler Lalonde and our newly appointed CEO, Justin Bromberg, to provide an update on Frontenac Municipal Services. We'll also coordinate to attend future meetings in South Frontenac and Frontenac Islands to address those councils as well. The Technical Support Committee for the Frontenac Municipal Services Corporation meets again on March 26th. And finally, I'll be joining Warden Lichty for 2 days of EOWC meetings at the end of the month. A few updates on the AMO front. So AMO has now issued an RFP to develop a comprehensive strategy to support local communities to foster civility and combat harassment. AMO is focusing on 3 primary areas in response to tariffs, estimating impacts on capital projects, looking at procurement, and municipal stimulus funding. AMO has also highlighted to the Premier how investment in municipal infrastructure and housing could help to protect construction jobs. This aligns well with one of the key focuses of the EOWC as well, which is infrastructure. In terms of a human resources update, 120 postings as of March 12th. We've been filling positions for our finance department, payroll and benefits clerk, as well as a temporary finance clerk. Summer student recruitment is ongoing. Paramedic recruitment is ongoing, as well as Fairmount Home as we prepare for the spring and the summer. In terms of labor relations, our QP 2290 union, we're moving towards interest arbitration. OPSU 462, which is our paramedic union, we were able to negotiate successfully an essential ambulance service agreement on March 13th, and bargaining will commence in July. For our ferry marine services QP 109 unit, the first day of bargaining is scheduled for April 2nd. And some miscellaneous items, the Verico scheduling software, the system has now been updated on their end, so we're planning to go live in May. And preparation is still ongoing for our first annual service recognition event that will be held in the fall. Recent Fairmount home improvements include the replacement of a domestic water booster system, installation of 27 ceiling lifts with more to go, and painting of common areas and handrails. So we're sprucing up the home. A few updates from the Frontenac paramedics. Community paramedics are beginning training with Kingston Health Science Center's Heat Function Clinic to support, sorry, that was Heart Function Clinic to support patients in the community with congestive heart failure. Paramedics Samantha and Caitlin, along with student Rose, recently presented at the Queen's Black Pre-Medical Association Conference. Recent research data shows that Frontenac paramedics achieve return of spontaneous circulation or a patient regaining their pulse in 25% of cases. And in April, we'll see paramedics begin a training cycle focused on mastering rare but essential skills and situational awareness training. Measurable digital engagements for February are up 9% from the same period a year ago. The top posts were related to Frontenac paramedics who received cardiac arrest save pins, as well as posts related to Family Day and Pink Shirt Day. The county video channel earned a total of 40 watch time hours, with 24 of those dedicated to the February 19th County Council meeting. So we are getting views. Planning applications are at an expected level for the winter. Staff are still busy processing several delegated authority consent applications in Central Frontenac that were submitted late last year, with circulations delayed because of the postal strike. On April 3rd, our Manager of Economic Development will be co-leading a webinar on trail towns and how businesses can benefit from becoming trail friendly. Richard will be sharing the experience of completing an assessment in Charbot Lake with a group of volunteers back in November. This webinar is aimed at communities located along the KMP Trail and the Eastern Ontario Trail Loop to help strengthen trail tourism in our region. Richard has also asked me to note that it appears snowmobile season is now done for the season, but ATVs are asked to wait until April so that the trail can dry out. This helps preserve our infrastructure and reduce maintenance needs. Our partner organizations will also post when the trail is open for ATVs. Finally, I also want to thank Debbie Miller and Rob Wood, as well as our Frontenac doctors. A lot of work has gone into the operational review that we just heard details on. And I just want to acknowledge that as we continue to work towards meeting these challenges and looking for solutions. And that's it from me. So thank you, Ward and Council, and I'll take any questions at this time.
Thank you, Mr. Farrell. Comments, questions? Councilor Greenwood-Spears?
Thank you for the report and that. I was a little curious, how many more overheads do we have to go? You've put in 27. I was surprised we're still putting in overheads. And approximately how much is the unit cost? Is that being covered by Ministry of Health? And that I honestly thought that it would have been looked after earlier in that. And also, is there anything other than X or Twitter? Because a lot of people don't want to use Elon Musk stuff anymore. And quite frankly, I saw the hits for Howe Island ferry information way down in that. And I honestly don't use X. I won't give them my information either. So is there something else we can use?
So I'll start with the first one, and Susan can jump in if I have this incorrect, but we already have the lifts. We're just repositioning them in better locations, but I'll let you speak to that, Susan.
So maybe I could just clarify, we have portable lifts and that's what staff have been using to this point. So it's an actual lift that they have to cart from room to room, which can cause, additional injuries from the staff members having to put them up in the room each time. So what we're actually doing is installing what we would call permanent lifts. So they stay in the room. So we're doing it over a 5-year plan because they are expensive to replace. So this 27 is kind of year 1 of year 5. So you will see it continue to come forward. But we did receive ministry funding. So we're actually going to be able to escalate it by 1 year because they do provide local priority funds, and we were successful in being provided $60,000 towards those purchases.
And then in terms of Twitter X, that's something we can take back and discuss with our communications team. But Yeah, I appreciate the sentiment, especially what's going on with US-Canada relations. So.
Other comments or questions for the CEO? Seeing none, Kevin, thank you for your presentation. Moving on, we have no unfinished business. The consent reports from the Chief Administrative Officer. There are no consent reports. We'll now move to, sorry, whenever our clerk flinches, I get nervous. Sorry about that. Move on to Committee of Management of Fairmont Homes.
Moved by Councillor Greenwood Spears, seconded by Warden Lichty, that Committee of the Whole Council adjourn and meet as Committee of Management of Fairmount Home with the Deputy Warden in the chair.
All in favor? Passed. The first item on the agenda is, make sure I have in this right order, 2025-029 Fairmont Home HQO Quality Improvement Plan Recommendation.
Moved by Councillor Gowdy and seconded by Councillor Leonard. Be it resolved that the Council of the County of Frontenac receive the Fairmount Home Health Quality Ontario Quality Improvement Plan Report, and further that the Council of the County of Frontenac approve the QIP submission to HQO.
We have a mover.
Yes.
Again, just checking. Comments, questions? Councillor Greenwood Spears.
Yes, it was nice to see the survey results and that for the responses and that. That being said, there was a couple of areas that we were a little bit lower than before. Not never mind. Wrong report. In that case, wonderful.
So it's not just me, Councillor Greenwood Spears. Thank you. Other comments, questions? Seeing none, all those in favor? Passed, approved. Next item on the agenda, 2025-030, Long-Term Care Home Service Accountability Agreement, which is also referred to as the LSAA, Schedule E, Form of Compliance Declaration. Recommendation?
Moved by Councillor Fowler, seconded by Councillor Smith. Resolved that the Council of the County of Frontenac receive the Fairmount Home Long-Term Care Home Service Accountability Agreement, Schedule E, Form of Compliance Declaration Report, and further that the Council of the County of Frontenac direct the clerk to sign the Long-Term Care Home Service Accountability Agreement, Schedule E, Form of Compliance Declaration for return to Ontario Health.
Since we already have a mover and a seconder, any comments, questions? Councillor Greenwood Spears.
I believe that's the correct report that has the satisfaction surveys on it.
No.
Next one. Okay.
Other comments, questions? Seeing none, all those in favor? Passed. Now get ready. The next item on the agenda is 2025-031 Fairmont Home Resident and Family Annual Satisfaction Survey 2024.
Moved by Councillor Smith, seconded by Warden Lichty, that the Committee of Management of, oh, sorry, that's just an information report.
So are there any, I believe there are questions on this report. Councillor Greenwood Spears.
There we go. That's the one that I was looking at. Sorry that there's 3 in a row there, but what concerned me was that there's a decrease in the number of responses from the family and residents. You know, when we have, you know, a large home here and that, and only 38 residents and 32 families responding back in 2023, and we're down to 22 and 40. I'm just wondering, is there any method we can employ to encourage them to respond even more favorably? And I do recognize that we actually are probably better off than some of the other, there was 8 long-term cares that were involved in this satisfaction piece. But for example, on one of the questions 8, I feel there's enough recreational programs to meet the individual needs and interest of the patient. We went from 94 to 77. I'm just wondering, did we lose a rec therapist or something of that nature? It seemed like a significant drop in that, but overall in that, we have a very good rating, and I appreciate that. I just always worry when we have a decreased number of people responding and significant decrease in recreation.
Susan, would you like to respond to that question? Thank you.
Yes, thank you. As far as the survey itself, it's offered both online and in person, and our programming team does go to seek the residents, asking if they require assistance to complete the survey, but of course it's voluntary, so we certainly can't make them complete the survey, but we do provide it in a paper copy. We provide staff assistance to do it. We provide it online. We provide it to families. So we do try to encourage them to do it, but maybe we could research some alternate options that may encourage more. And as far as your other question in relation to the family survey that touched base on the programming concerns, if you'll notice, I found it interesting that if you look at the residents' rate of their enjoyment of recreation, it's actually at 96%. And their satisfaction with their assistance and encouragement from the recreation team is also at 94%. So there seems to be a disconnect between the family's perception and the residents' perception. So it's something that we will bring forward at residents council, as well as, you know, a family council question to seek their input as well. But both of those committees maybe can provide us additional guidance.
Further question?
Yeah, just regarding question 47, which was another one that sort of caught my attention, and that is, I am satisfied with my involvement and or work with the residents' council in the home. We went from a 73 to 46%, a 41% drop basically in that, and we didn't actually hit the average for that even before with the other long-term care. Is there something we can do to improve our residents' council?
So the home has already implemented a change for that as well. Previously, we had kind of an all-encompassing residents council meeting that included all home areas. You know, sometimes the residents were unable to attend or maybe didn't feel comfortable. So what we've instituted is home area meetings. So each resident, each of the 4 home areas have their own residents council meeting, and then have a lead that goes to the bigger home-wide meeting. So they bring forward the agenda, but our programming team, who's been really great at the independent resident council meetings on the home areas, also brings the agenda minutes to them from the larger home-wide meeting, so that it kind of keeps everyone more involved, makes them feel more involved, even if they can't actually participate in the home-wide one. So I expect to see a difference in that next year.
Any other questions or comments on this information report? Seeing none, thank you.
So through you, Deputy Warden, we just have a motion now to return back to Committee of the Whole. That's moved by Councillor Smith, seconded by Warden Lichty, that the Committee of Management of Fairmount Home adjourn and revert back to Committee of the Whole Council.
All those in favor? Thank you. Councillor Smith, thank you for clarifying that. Thank you. We've already covered the next 2 items, so we'll move on to item C, which is 2025-033, Emergency and Transportation Services 2024 Legislative Response Time Standard Performance Plan, reporting to the Ministry of Health. Recommendation?
Moved by Councillor Leonard, seconded by Councillor Fowler. Be it resolved that Council received the report for information, and further that the 2024 Response Time Standard Performance Plan outcomes for the County of Frontenac be reported to the Director, Emergency Health Regulatory and Accountability Branch, Ministry of Health, as required by legislation.
Comments, questions? Councillor Greenwood-Spears?
Quick question that I'm looking at the target for the CTAS responses and there's a 48% that we've hit, and for within 6 minutes, and then everything else 8, 10, and 10. but we'll never get above that 70 and 75%, it seems, for any of these, as long as we have that limitation of Frontenac Islands in particular, and Howe Island also would impact this significantly. So at some point in time, our 24 responses and that aren't really hitting the target for our CTAS 5, which I think is 4 hours. And that we saw, it says 10 minutes here. So I'm just a little confused as to how we looked at a report before saying that CTAS 5 can occur within a 4-hour time period, 240 minutes. And now we have it as a 10-minute response time. So I just wanted a little clarification on these figures, if I could.
Yeah, appreciate the question. And so this is just to give us authority to report on what occurred based on our previous response times for 2024. This council will remember that they recently passed new response times that align better with the new dispatch system. So this council did pass new response targets for 2025 that I think that's what you're speaking of. It aligns with the different timelines associated with MPDS. So this is just to close the reporting loop on the previous year.
Sorry, any other comments or questions? Seeing none, all those in favor? Passed. We now move on to the next item, which is 2025-035 KP Trail, Trans-Canada Trail Grant for Gate Signage, Wind Wayfinding Signs, and Kilometer Markers. Recommendation?
Moved by Councillor Fowler and seconded by Councillor Smith. Be it resolved that council receive the report, and further that the warden and clerk be authorized to enter into an agreement with Trans-Canada Trail for the purpose of funding the gate, wayfinding, and kilometer marker signs as described in the report.
Comments, questions? Councillor Fowler.
I was just wondering, I was looking at the diagram, what is the signs actually made of?
Richard, can you answer that question for us, please?
Some of the signs are made of alu panel, which is a cheaper form of aluminum, and some are made of aluminum.
Well, are they capable of holding up in the weather?
Yes, we have experience using all of these signs already on the trail.
Any other comments, questions? Councillor Greenwood Spears?
Of our 78 kilometers, how many of those kilometers will be remaining vehicle-free, other than snowmobiles in the wintertime?
So kilometer 21 to kilometer 39 are vehicle free. And then there's 1 kilometer up at Duncan Lake that is also vehicle free. So approximately 30 kilometers are vehicle free.
So the Trans-Canada section that we're applying for the funding and the signing and that, is that vehicle free or is that multi-use?
So some of the signage, the kilometer signage, covers the whole trail, but the wayfinding signage that's being added to the sign, the gates, those gates are there as access barriers to prevent motorized vehicles from accessing the trail. So the primary location of this funding in this project is in the active transportation section of the trail.
Other comments, questions? Seeing none, all those in favor? Passed. Next item on the agenda is information reports from the Chief Administrative Officer. This is an information report, corporate services, 2024 remuneration and reimbursement of expenses to council members and non-council appointee report. Comments, questions? That report is received. Thank you. We're now on to the next report, which is reports from the Advisory Committee of County Council. Report of the Governance Committee Review, the report of the Governance Review Committee.
So that's moved by Councillor Greenwood Spears, seconded by Warden Lichty, that the report received from the Governance Review Committee be received and adopted. And there are two items in there, the delegation of authority bylaw and the sale, disposition, and land use policy for the County of Frontenac.
And I believe these will be covered by one motion. And are there any items on those reports that a council member would like to have removed or dealt with separately? Seeing none, so it'll be treated as one motion. So the first item, report 2025-025, corporate services, adoption of an updated delegation of authority policy. Comments, questions? Seeing none, that is received or approved. Thank you. Next report is 2025-027, corporate services, adoption of a sale, disposition, and land use policy for the County of Frontenac. Comments, questions? Seeing none? For the public's knowledge, approximately how many hours would have been put in by that committee to put this together?
Our staff have done amazing work on this. They've put a lot of hours in to get it this far. Definitely more than us.
I just want to acknowledge the effort that some members of council put in as well as staff, so thank you for that. Okay, so all in favor? Received, thank you. I think it's you. Return to council.
Moved by Councillor Gowdy, seconded by Councillor Leonard, that council revert from committee of the whole council to council.
All those in favor? Thank you. Passed.
Adoption of the report of the Committee of the Whole Council.
Moved by Councillor Fowler, seconded by Deputy Warden Saunders, that the report of the Committee of the Whole Council be adopted and that the necessary actions or bylaws be enacted.
Any comments? In favor? Carried. We have no motions or notice of which has been given. Does anyone wish to give notice of motion? Seeing none. Communications?
You're just there for the public.
Yeah. So the council consents to the following communications of interest to council listed below to be received and filed. Is there any other business? Seeing none. Bylaws, general bylaws and confirmatory bylaw.
First reading is moved by Councillor Smith, seconded by Councillor Vandewaal. Resolved that leave be given to the mover to introduce bylaws A through D that have been circulated to all members of County Council, and that bylaws A through D be read a first and second time.
Comments? In favor? Carried. Third reading.
Moved by Councillor Smith, seconded by Councillor Vandewaal. Resolved that bylaws A through D be read a third time, signed, sealed, and finally passed.
Comments? In favor? Carried. And that brings us to the item called adjournment.
Moved by Councillor Gowdy, seconded by Councillor Greenwood Spears, that the meeting hereby adjourn at 10:36 a.m.
In favor? Carried. Thank you, folks.